Ectopic pregnancy, a potentially dangerous situation. An ectopic pregnancy occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tube. This is a serious condition that requires prompt medical attention. In a normal pregnancy, the fertilized egg implants in the uterus where it grows and develops. However, in an ectopic pregnancy, the egg cannot survive outside the uterus. The fallopian tubes are not designed to support a growing pregnancy. If left untreated, an ectopic pregnancy can cause the fallopian tube to rupture, leading to life-threatening internal bleeding. It's important to understand the risks and symptoms associated with ectopic pregnancies. Early detection and treatment are crucial for the best possible outcome. Remember, if you suspect you may have an ectopic pregnancy, seek immediate medical attention. Your health and well-being are paramount. Recognizing the warning signs. Symptoms of an ectopic pregnancy. Recognizing the symptoms of an ectopic pregnancy is crucial for early detection and intervention. While these symptoms can sometimes mimic those of a normal pregnancy, there are some key differences. One of the most common signs is abdominal pain, which may be sharp, stabbing, or cramp-like. This pain may be localized to one side of the abdomen, or it may radiate to the back or shoulder. Vaginal bleeding is another common symptom, although it may not occur in all cases. The bleeding may be light or heavy, and it may be accompanied by clots or tissue. In some cases, women may mistake this bleeding for a normal period, which can delay diagnosis. Other symptoms include dizziness, lightheadedness, and fainting. If you experience any of these symptoms, especially in combination, it is essential to seek medical attention immediately. Do not delay, as early diagnosis and treatment can significantly improve outcomes.
Understanding the risk factors that increase the likelihood. Several factors can increase a woman's risk of experiencing an ectopic pregnancy. One significant risk factor is a previous ectopic pregnancy. Women who have had one have a higher chance of another. Pelvic infections like PID increase the risk. PID causes scarring, hindering egg travel to the uterus. Other factors include smoking and certain fertility treatments.
Proactive steps for prevention. Reducing your risk of ectopic pregnancy. While not all ectopic pregnancies are preventable, there are steps you can take to reduce your risk. One of the most important is to protect yourself from sexually transmitted infections. Sexually transmitted infections, particularly chlamydia and gonorrhea, can lead to pelvic inflammatory disease, a major risk factor for ectopic pregnancy. Practicing safe sex by using condoms consistently and correctly can significantly reduce your risk of contracting an STI. Regular STI testing is also crucial, especially if you have multiple sexual partners. If you are diagnosed with an STI, it is essential to complete the full course of antibiotics as prescribed by your doctor to prevent complications like pelvic inflammatory disease. Remember, prevention is always better than cure. By taking proactive steps to protect your sexual health, you can significantly reduce your risk of developing an ectopic pregnancy.
Section 5. The importance of early detection. Regular checkups and ultrasounds. Early detection is crucial in managing ectopic pregnancies effectively. Regular checkups with your gynecologist or healthcare provider are essential, especially if you are planning a pregnancy or are at an increased risk of developing complications. During these checkups, your doctor will assess your overall health, discuss any concerns you may have, and perform a pelvic exam if necessary. Ultrasound scans play a vital role in diagnosing ectopic pregnancies. These scans use sound waves to create images of your reproductive organs, allowing your doctor to visualize the location of the pregnancy. An early ultrasound can detect an ectopic pregnancy before it causes any serious complications. If you experience any unusual symptoms, such as abdominal pain or vaginal bleeding during pregnancy, it is essential to contact your healthcare provider immediately. Early detection through regular checkups and ultrasounds can significantly improve outcomes in cases of ectopic pregnancy.
Section 6. Living a healthy lifestyle, nutrition, exercise, and avoiding harmful substances. Maintaining a healthy lifestyle is crucial for overall well-being, and it can also play a role in reducing the risk of complications during pregnancy, including ectopic pregnancies. A balanced diet, rich in fruits, vegetables, whole grains, and lean protein, provides essential nutrients for reproductive health. Regular exercise is also beneficial, improving blood circulation, reducing stress, and maintaining a healthy weight. However, it's important to avoid strenuous activities and consult with your doctor before starting any new exercise program, especially if you are pregnant or planning to become pregnant. Additionally, it's crucial to avoid smoking and excessive alcohol consumption. Smoking damages blood vessels and can increase the risk of ectopic pregnancy, while excessive alcohol intake can harm fetal development. By adopting a healthy lifestyle, you can support your overall health and potentially reduce the risk of pregnancy complications.
Section 7. Protecting your sexual health, safe sex, and preventing STIs. Protecting your sexual health is paramount in preventing ectopic pregnancies, as sexually transmitted infections, or STIs, can significantly increase the risk. STIs like chlamydia and gonorrhea can lead to pelvic inflammatory disease, or PID, a major risk factor for ectopic pregnancy. PID occurs when an infection spreads from the vagina or cervix to the uterus, fallopian tubes, or ovaries. Practicing safe sex by using barrier methods, such as condoms, consistently and correctly, is crucial in preventing STIs. Condoms act as a physical barrier, preventing the exchange of bodily fluids during sexual activity. It's essential to use a new condom for each sexual encounter and ensure it is used correctly to maximize its effectiveness. Regular STI testing is also vital, especially if you have multiple sexual partners or engage in unprotected sex. Early detection and treatment of STIs can prevent the development of PID and reduce the risk of ectopic pregnancy.
Section 8. Managing underlying conditions, endometriosis, PID, and other factors. Managing underlying medical conditions that can affect reproductive health is crucial in reducing the risk of ectopic pregnancy. Endometriosis, a condition where tissue similar to the lining of the uterus grows outside the uterus, can increase the likelihood of ectopic pregnancy. Pelvic inflammatory disease, or PID, as discussed earlier, is another significant risk factor. PID can cause scarring and damage to the fallopian tubes, making it difficult for a fertilized egg to travel to the uterus, increasing the chances of an ectopic implantation. If you have been diagnosed with endometriosis, PID, or any other condition that may affect your reproductive health, it is essential to work closely with your healthcare provider to manage the condition effectively. This may involve medication, surgery, or lifestyle modifications tailored to your specific needs.
Section 9. Choosing the right contraception. Discussing options with your doctor. Choosing the right contraception method is crucial for preventing unintended pregnancies, including ectopic pregnancies. It's essential to discuss your medical history, lifestyle, and preferences with your healthcare provider to determine the most suitable option for you. Some contraceptive methods, such as condoms, not only prevent pregnancy, but also protect against STIs, further reducing the risk of ectopic pregnancy. Other methods like hormonal contraceptives, including birth control pills, patches, and rings, work by preventing ovulation or thickening cervical mucus, making it difficult for sperm to reach the egg. Long-acting reversible contraceptives, or LRCs, such as intrauterine devices, IUDs, and implants, provide highly effective and long-term protection against pregnancy. IUDs are small T-shaped devices inserted into the uterus, while implants are placed under the skin of the upper arm. Both methods release hormones that prevent pregnancy.
Section 10. Medical and surgical treatments. Addressing ectopic pregnancies. Prompt medical intervention is necessary to prevent life-threatening complications. Treatment depends on the location, overall health, and whether the fallopian tube has ruptured. Medication may stop the growth of the ectopic pregnancy. Surgery may be necessary to remove the ectopic pregnancy, typically done using a minimally invasive procedure called laparoscopy.
Section 11. Seeking immediate medical attention. When to consult a healthcare professional. It is crucial to seek immediate medical attention if you experience any symptoms suggestive of an ectopic pregnancy. These symptoms may include severe abdominal or pelvic pain, vaginal bleeding, dizziness, lightheadedness, or fainting. Do not delay seeking medical help, as early diagnosis and treatment are essential for the best possible outcome. If you have any concerns about your reproductive health or are experiencing unusual symptoms, it is always best to err on the side of caution and consult with a healthcare professional. They can assess your individual situation, provide appropriate guidance, and address any questions or concerns you may have. Remember, your health and well-being are paramount. Early detection and treatment can make a significant difference in managing ectopic pregnancies and ensuring the best possible outcome.